Women's bodies and social expectations change over their life course, and it is essential to align counseling opportunities with the stages of life women go through. Different counseling approaches have been employed for family planning, but these counseling approaches are designed using the concept of one-size-fits-all. Some women may not be able to relate because they would have to sift through the information they're receiving to figure out what applies to them where they are in their life's journey. Many women are not motivated enough to do this extra work. Family planning providers, programmers, and policymakers need to think more strategically about aligning the experiences of women's lives to the family planning and contraceptive counseling messages they're given. After a few simple screening questions, women of reproductive age should be assigned to one of 3 life stages. Suggestions of screening questions include: number 1, how old are you? Number 2, how frequently do you have sexual intercourse? Is this weekly, monthly, once every few months, just a few times a year? Number 3, are you ready to have children, or have you started having children? Number 4, what are your fertility desires? Is it that you're not ready for children, or you want to have another child soon or within the next 2 years? Or you want to wait at least 2 years before having more children or before having children? Or you want no more children? The responses to these 4 questions will help a health worker have a clearer understanding of which life stage a client is in, so she can receive counseling that is tailored for that life stage, laying emphasis on methods that suit her best, while still introducing her to all methods available. This approach will allow the brief time allocated to counseling to be optimized and will show the relevance of the personalized counseling session to the woman almost as soon as the session commences. Providers must be properly trained and retrained for this approach so they do not introduce bias into the counseling session. There are 3 main life stages women pass through during their reproductive years. First, she's a young woman. Next, she's focused on her career and family. And finally, she enters a stage where she has to balance her life. Let's start with the young women. With some women marrying later than their parents did, largely due to the need to obtain formal education and a means of livelihood, some women ages 15 to 24 years and at this life stage are not ready to plan their families and may resist the term family planning. To communicate appropriately with such young women, providers need to be consistent with the term contraception rather than family planning. These young women may not yet be married, but may be sexually active, and providers must be able to respect this decision as professionals without expressing their own personal moral and religious convictions. While short-acting methods may be sufficient for those with infrequent sexual intercourse who are not ready to start a family and have children, their counterparts who have more frequent sexual encounters and may have started having children would probably be better served with long-acting methods to adequately space births. This life stage approach to counseling must be personalized. Research suggests that good counseling prior to adoption of a contraceptive strategy is associated with client satisfaction, continuation of a method beyond 12 months, as well as reduced discontinuation. Counseling also encourages openness to method switching when women experience side effects with a given method. The next life stage a woman passes through is that focused on career and family. During this life stage, many women are focused on giving birth to and raising young children while also building a career. Given the widespread myths and misconceptions that women have encountered, it is important for providers to dedicate time during their counseling session to allay the fears of these women and provide professional information on possible side effects, how to manage them, the potential to switch to another method, and the timing of return to fertility once a method is stopped, especially since most women at this life stage who use family planning methods do so to space rather than to limit births. She's focused on her career and her growing family and needs correct information to make an informed decision, preferably with her partner. Next, a woman enters the life stage where she has to balance her life and various commitments. By the time many women enter this life stage, they have had all the children they would like to have. However, some women at this life stage remain sexually active but are not doing anything to avoid pregnancy. Given the widespread myths and misconceptions that women have encountered, it is important for providers to dedicate time during their counseling session to allay the fears of these women and provide professional information on possible side effects, how to manage them, the potential to switch to another method, and the difference between long-acting and permanent methods, especially since most women at this life stage who use family planning methods do so to limit rather than to space births. This suggestion to transition to a life stage appropriate, personalized approach to family planning counseling will require a reorientation and retraining of family planning providers and programmers. But this should not be seen as an expensive, insurmountable challenge. A modular, self-paced training should be designed and approved by the Federal Ministry of Health in Nigeria. Each family planning provider will be required to complete the self-paced training and accompanying self-administered test on an annual basis as part of a continuing professional education program. To sum up, I recommend a life stage appropriate, personalized approach to contraceptive counseling. For this to be effective, family planning workers must receive a reorientation and be retrained. When the counselors are counseled, they counsel better. Good counseling will encourage continued use of family planning methods by women and their partners, thus improving Nigeria's contraceptive prevalence rate, one woman and one couple at a time. Excited? I am. For further discussions, please reach out to me. Thank you for your attention and interest.